Well, good evening, everyone. Welcome back to News Channel 5 Plus. We are here with another Medical Monday. Joining us, Dr. Ben Lim. Thank you so much for being here tonight.
Thank you, Casey. I enjoyed this.
Now, if you're just tuning in, we, of course, are talking about falling in love with your skin tonight. We're not talking about more of the diseases or things like skin cancer or rashes or different things that folks deal with on that side of the spectrum. Instead, we're talking about more about the 5 R's, which are...
It's going to be relax, refill, resurface, reposition, and reshaping.
All right, and to see if I can memorize those by the end of the show. Pop quiz for me here. Yeah, it's really just about, falling in love with your skin on a lighter note this evening. So let's go ahead and talk about the first 2 R's during this segment. We're going to talk about relaxing and refilling, and you actually did bring in some great new exciting techniques. We're excited to have props here on the set tonight. Okay. So take it away, doctor. We're talking about relaxing and refilling.
Well, I'll start off with relaxing first, because we typically have heard about Botox, and Botox now has become part of the lexicon of our society. You'll hear about people getting Botoxed. And what is it? It is actually botulinum toxin, but at the same time, when used properly, we call it a neuromodulator that actually can selectively relax muscles of facial expression. The most common areas that you'll hear people using Botox for is for the upper third of the face. And the upper third of the face, we have our frown area right here, our worry lines when we raise our eyebrows, that gives you the horizontal lines. You also have the crow's feet when we smile and it really crinkles. But outside of those areas where we can relax things, there are other areas that would also benefit on the lower 2/3 of the face. So some of the unique techniques that we have that can help people, and I'll just briefly point out some of the things. Sometimes if people want to open up their eyes so that it's more of a doe type look and it looks very friendly, we can actually put Botox around the eyes to open up the eyes more. Sometimes people have these little lines that we call wolf or bunny lines on the side of the nose, and we can inject that to relax it. When people smile, sometimes people will have what we call a gummy smile because the gums show too much, but if you inject Botox appropriately in the upper lip, you can actually help reduce that. You can also inject in order to lift up the corners of the mouth so that you don't have a downward turn that makes people can look sad. You can actually use Botox or a similar product like that to actually open up the upper lip a little bit so it gives a sense of fullness without needing to use a filler. And certainly if you have dimpling of the chin, that can be used for that. Some of the more innovative ways is for people who sometimes have a more squarish face. Well, placing injections in certain areas of the lateral cheeks can also be used to actually reshape the face and give it a more of a softer oval look. That's also very nice. Yeah,
okay, so common question I'm sure you get as a dermatologist, I'm scared to try this. I don't want to look, like I have had Botox. I think that's one of the main things is you almost want it to look like you didn't have anything done. What is your advice to potential consumers and patients when they're asking you about entering into this treatment for the very first time? It could be scary when you're trying to figure this out.
One of the first things I tell my patients is that I've been doing Botox on myself since 1996.
Yes, as you said, you're 125.
That's right.
That right? You look incredible.
Absolutely. And I did it on myself because I actually wanted to prevent the formation of deep lines in the frown area because I had a natural tendency to do so. But I think that looking natural is what people want to have, as opposed to having that frozen look that we all fear. And so I tell people we relax, we do not paralyze. And so we can be more judicious in terms of how much we use in order to affect that. And so you need to go to someone who is an expert, someone who has the advanced training to do it well. And I would say that as a dermatologist, I feel that our specialty is very well qualified to do that because we were the innovators of using botulinum toxin or Botox to help with this.
You know, we talked about this during the break as well. the times are changing with the advancements in Botox and filler. And as a doctor, what would you like to say as far as any sort of stigma towards receiving this type of treatment?
Right. One of the most common comments that I will get from people is that, am I being too vain by doing this? Shouldn't I just age gracefully? And I answer to that is that, well, we like to present ourselves to the public in the best way we can. That's the reason why we may get our hair done. That's why we may groom ourselves by, if someone has facial hair with a mustache or beard, they groom their facial hair. That's why we brush our teeth.
Getting braces. I was going to say a good example is it any different than, you know, getting braces straightened on your teeth, you know? So
no, it isn't, and it's as I said in the previous segment, the #1 reason why consumers want to get these cosmetic medical procedures is so that they can feel better about themselves. So it's more about how we want to feel about ourselves, and we want to present ourselves in the best possible way to the world.
And again, for maybe folks that are just now tuning in, go ahead and tell those 3 reasons, the main reasons that, you know, folks are now receiving cosmetic medical procedures, as we're calling them.
Right. Well, the #1 reason was that people did want to feel better about themselves, and so if you get procedures done that make you look better, you will feel better about yourself when you look in the mirror, and you have more confidence. #2 is that people do want to look more attractive. We want to present ourselves in the best possible way. Why wouldn't we?
Why not?
That's right. And thirdly is that we are living longer now. As a nation, our citizens, Americans, are living longer. So as we're living longer, we're also staying more healthy physically. So we want to also look as best as we can for our age, or even better. Because if we feel younger on the inside, why should we not try to also still look young on the outside?
Well said. Now we do have a caller. This is Brian on line 1. Good evening, Brian.
Hey, good evening.
Nice to have you on. And what's the question you have this evening for Dr. Benlam?
Yeah, I told the lady, I said, I don't know, guys, if you call on the show, but I'm 52 and my skin's in pretty good shape. I'm like sort of half French, half Irish, half Algerian descent. My skin's not really pale, even though I'm Irish. I may be known to have blotches, but I don't have any wrinkles. I'm 52. And
that's wonderful,
I used to tan a lot when I was younger, I told her, but not for the last like 10, 15 years. But, you know, if you're out, you know, you'll get sun. And I use alpha hydroxy and lotion. I always have. And she asked me the name brand, and you know, I don't know if I can tell you that. It's sort of an orange blossom special out of Miami, Cocoa Beach, Florida. It's my lady. And then I also get a regular one. I just put on after I'm shaving, and I'm just starting to get some wrinkles, but I seem not to have any. So I don't know if it's, you know.
Brian, you're a very fortunate man.
Yes.
You have very good genetics.
Share
that
your
is
secrets
fantastic.
with us.
And not everyone will have your great genetics where simple skincare regimen will be enough. And so this is why we're talking about cosmetic medical procedures tonight, because skincare products alone will not be sufficient for a good number of people.
Yeah, you know, Brian, thank you so much for calling in. We do appreciate our calls, and again, encouraging you to call in tonight. That's a great story, and I want to ask, kind of stemming off of what Brian just called in to say, is how much do our genes and genetics play a role in our skin, and how much can be done to, you know, let's say you have in, you know, your family deep set wrinkles that is genetic, and what can we do to maybe prevent that from happening?
Right. So one of the major factors that leads to premature aging is actually photo damage. And if someone is more fair skinned, it's more easy for them to get sun damaged skin at a younger age. If you enjoy the outdoors, you want to be outside a lot, that's where we see premature aging come on. And certainly other things such as how well do we take care of our body with our nutrition? Do we partake of things that may affect our skin, such as smoking, alcohol, and the like? So our skin, it's the only skin that we have, so we want to take care of it as possible. But certainly genetically, if people have more fair skin, they can get sun damage more easily, and that manifests as premature aging.
It's always the sun is always the culprit. Now, you once said too that, you know, there's no such thing as a safe tan in my, oh my, is that true? Now, I believe we have, is it Patricia here on line 1? Good evening, Patricia.
Hi.
Hi there. So what's your question for us tonight? Thank you so much for calling in.
Well, I have a question regarding Botox. I was interested in getting Botox because of the frown lines on my forehead, right between my eyes and my eyebrows. And I was told by several different professionals conflicting things. One person told me that because I have had a reaction to a flu shot and I had Guillain-Barré syndrome, that I could not have Botox at all because it could cause serious damage. Other professionals have told me that there's no risk at all, you know, outside of just general risk of Botox. And so I'm still toying around with the idea, but I would like to get Dr. Binham's opinion about this.
Yeah, great question, and thank you so much for calling in.
Patricia, that is an excellent question, and I definitely appreciate your concern. And as a medical professional, I will tell you that in order to better assess you as an individual, we would need to really delve more into your medical history to give the most correct answer. However, in general, Botox or botulinum toxin should be very safe for the vast majority of individuals. So I think that's something that you may want to bring up again with whoever you choose to see to really review your medical history, I think, again, before making that final determination.
All right, great. We appreciate those calls from you all tonight and appreciate you tuning in here to News Channel 5+. You're joining us for Medical Monday, getting lots of great advice from Dr. Binham. And coming up after this quick break, stay with us because we're going to have a really interesting demonstration that Dr. going to do for us tonight. So keep it right here. We'll be right back.